Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and that's all that I do. I just do cosmetic surgery. I do a lot of body contouring surgery, and I do something called an hourglass makeover. And often people ask me, Dr. Shapiro, what procedures can be combined to perform an hourglass makeover or give me an hourglass shape? And the answer is there are very many of them that can be combined or done at different times. Non-invasively CoolSculpting, which actually freezes the fat and allows you to lose that fat in a permanent fashion, is done non-invasively, and that has become a lot more prominent and a lot more popular, especially since the adapters that are put on your body to freeze the fat have become much more easy to apply and are smaller for specific areas. So these adapters used to be something that just grabbed the abdomen in a large fashion. Now they can go on particular areas, whether it be on the abdomen, the flanks, et cetera, they can help give you that hourglass shape by specifically reducing fat in certain areas. So if we wanted to really reduce fat in the abdomen and flanks and lower back, we can help give you that hourglass shape. When we start talking about surgical procedures, we really talk about liposuction. I do many kinds of liposuction, the first being vaser liposuction, which is actually ultrasonic liposuction. Another is called safe liposuction, that's S-A-F-E liposuction, that actually helps promote some skin tightening more aggressively than vaser liposuction. The last is vaser high definition liposuction, which is a much more advanced technique that requires a bit more downtime. A lot of these procedures can be combined to give you an hourglass shape. That is that I would do specific liposuction in the abdominal area and flank area to minimize the waist area. So we want to actually tighten that waist area and leave some fullness above and below that to help accentuate that hourglass shape. Oftentimes I will take that fat, I'll process it and re-inject it in certain areas, either it be the rear end or the hips, to give people more of that voluptuous curves that people are looking for these days. So the answer is there are very many different things that can be done to perform an hourglass makeover. The recovery of that really depends upon which procedures I do, and of course if I need to do something like a tummy tuck, that can be added also. But the best way to figure out if you're a candidate for something like an hourglass makeover, whether you need non-invasive or more invasive techniques like liposuction, the best way to get an idea is to come in for a consultation, show me some pictures about what you're looking for, we discuss what your expectations are, and then we just go from there. Thanks a lot.